Did you know that medications sitting in your medicine cabinet right now could be silently weakening your heart without you realizing it? Recent studies reveal that over 70% of adults over 60 take at least one medication that poses potential cardiovascular risks, yet most patients, and even some healthcare providers, remain unaware of these hidden dangers. I'm Dr. Elena Carter, a physician with over 10 years of experience specializing in health and wellness for people over 50, and today I'm going to expose 5 categories of common medications that could be putting your heart at serious risk. We'll uncover why that pain reliever you take for arthritis might be overloading your cardiovascular system, how your stomach protector could be disrupting your heart rhythm, and the surprising truth about calcium supplements that the medical community is still debating. Throughout this video, I'll share real patient stories, explain the science behind these risks, and most importantly, provide you with practical alternatives to protect your heart while managing your health conditions. What I'm about to share with you comes from years of clinical experience and mounting scientific evidence that demands our attention. These aren't experimental drugs or rare treatments we're talking about. These are over-the-counter pain relievers, stomach acid reducers you might take every morning, simple cold medicines, certain older antidepressants, and even supplements you take for bone health. The pharmaceutical industry and many healthcare providers have been slow to fully communicate these risks, leaving millions of people unknowingly vulnerable. My goal today isn't to frighten you or suggest you stop taking necessary medications. Instead, I want to empower you with knowledge so you can have informed conversations with your healthcare provider and make decisions that truly protect your long-term health. Let me start with the most commonly used and perhaps most dangerous category for your cardiovascular system. We're talking about non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. These include household names like ibuprofen, naproxen, and diclofenac. You probably have at least one of these in your home right now. They're our go-to solution for headaches, back pain, and arthritis discomfort. While they're undeniably effective for pain relief, using them without proper caution, especially if you're over 60 or have existing heart conditions, is like playing a dangerous game with your cardiovascular health. The medical community has known about the dark side of these seemingly harmless pills for years. As early as 2005, the FDA required clear warnings about increased risks of heart attacks and strokes on NSAID packaging. Let me share the story of one of my patients, Margaret, a 74-year-old retired teacher who loved gardening. She suffered from knee arthritis and had been taking diclofenac almost daily for months to manage her pain. One afternoon, while tending to her vegetable garden, she became extremely fatigued, experienced shortness of breath, and noticed her ankles had swollen to twice their normal size. In the emergency room, we discovered she was experiencing acute heart failure. Her heart, already working harder due to her age and mild hypertension, simply couldn't cope anymore. The trigger wasn't a new cardiac problem, but rather the continuous use of that seemingly innocent anti-inflammatory medication. How can something so common be so dangerous? The mechanism is subtle but significant. NSAIDs block certain enzymes to reduce inflammation, but in doing so, they also interfere with substances that protect our kidneys and blood vessels. This creates 2 devastating effects on your cardiovascular system. First, they cause your body to retain salt and water. Think of your heart as a pump and your circulatory system as the plumbing. When there's suddenly much more fluid in the pipes, the pump has to work at maximum capacity. A young, healthy heart might handle this increased workload, but an aging heart or one already dealing with high blood pressure can become overwhelmed, just like what happened to Margaret. Second, non-steroidal anti-inflammatory drugs can constrict blood vessels and elevate blood pressure. Even if you don't have hypertension, regular use can raise your blood pressure. If you're already taking blood pressure medication, NSAIDs can counteract their effectiveness, causing your blood pressure to spike without you realizing it. It's crucial to understand that the risk depends on both dosage and duration of use. Medications like diclofenac and high-dose ibuprofen, particularly at doses of 2,400 milligrams daily, are most strongly associated with cardiovascular problems. Naproxen at lower doses appears somewhat safer, but the risk is never zero. Additionally, if you take low-dose aspirin to protect your heart, some NSAIDs like ibuprofen can actually cancel out aspirin's protective effects. So what should you do? The solution isn't to endure pain, but rather to have an honest conversation with your healthcare provider. Ask specifically, Doctor, given my medical history, what's the safest pain management option for me? There are alternatives available. Sometimes acetaminophen is sufficient for pain relief. Other times, topical anti-inflammatory creams or gels that work locally are excellent options. If an NSAID is absolutely necessary, the golden rule is the lowest effective dose for the shortest possible time. Now let's move to our next category, and this one might surprise you because it's known as a stomach protector. I'm referring to proton pump inhibitors, or PPIs. These include omeprazole, pantoprazole, and lansoprazole. They're among the most widely sold medications in the world. Millions of people take them every morning, almost like a daily ritual, for acid reflux or to protect their stomach from other medications like the NSAIDs we just discussed. Here's the irony that concerns me deeply as a physician. The medication prescribed to protect you from one risk might be creating another risk through an entirely different pathway. Let me tell you about Patricia, a 69-year-old patient who was prescribed omeprazole for chronic acid reflux. Her doctor told her to take it indefinitely. Her heartburn disappeared completely, and she never questioned the treatment again. Years later, during a routine checkup, her electrocardiogram showed some concerning irregularities. Blood tests revealed the cause. Her magnesium levels were dangerously low. Magnesium acts as the guardian of your heart rhythm. When it's deficient, your heart becomes electrically unstable, like an orchestra without a conductor, and dangerous arrhythmias can develop. The cause of Patricia's magnesium deficiency was her chronic use of omeprazole. PPIs reduce stomach acid production, but that acidity is crucial for absorbing essential nutrients. When you suppress it for extended periods, magnesium absorption plummets dramatically. But the concerns don't stop there. Several large observational studies have found an association between PPI use and increased heart attack risk. One theory suggests these medications might reduce levels of nitric oxide, a molecule that keeps our blood vessels flexible and healthy. When nitric oxide is depleted, vessels become stiff and rigid, setting the stage for cardiovascular events. While the causal relationship is still being debated in medical circles, the association is concerning enough to warrant caution. Additionally, omeprazole can interfere with vital medications like clopidogrel, a blood thinner often prescribed after heart attacks. It can make this protective medication less effective, potentially leaving patients vulnerable to future cardiac events. The problem is that these medications have become far too casual in their use. They were originally designed for short-term treatment of 4 to 8 weeks, but they've evolved into permanent solutions for problems that could often be managed through lifestyle modifications. If you've been taking a PPI for months or years, please don't stop suddenly. Have a conversation with your doctor. Ask these important questions. Do I really need this long-term? Can we reduce the dose gradually? Are there safer alternatives for my specific condition? If you must take it chronically, it's essential that your doctor monitors your magnesium levels regularly and considers supplementation if necessary. Let's continue with our third category, one that almost everyone has in their home. We're talking about oral decongestants for common colds, those containing pseudoephedrine or phenylephrine. They seem like the magical solution for that stuffy nose that won't let you rest. But that magical solution can carry a very high cost for your heart, especially if you already have high blood pressure or any form of heart disease. Let me share the story of Susan, a 76-year-old retired nurse who caught a severe cold. To breathe properly, she purchased a well-known cold medication containing pseudoephedrine from her local pharmacy. By the second day, she started feeling like her heart was going to burst out of her chest, accompanied by severe dizziness and a terrible headache. Her daughter rushed her to the hospital, where we found her blood pressure was extremely elevated and she was experiencing a dangerous arrhythmia. That seemingly innocent decongestant had pushed her cardiovascular system to its breaking point. Why does this happen? Pseudoephedrine and phenylephrine are vasoconstrictors. Their job is to narrow blood vessels. In your nasal passages, this is beneficial because it reduces inflammation and allows you to breathe. However, the medication doesn't act only in your nose. It travels throughout your entire body, constricting blood vessels everywhere. This creates two serious consequences for your cardiovascular system. First, by narrowing your arteries, your heart must pump against much greater resistance. It's like trying to force water through a compressed hose. The pressure skyrockets dramatically. This can trigger dangerously high blood pressure spikes that can be life-threatening. Second, these medications are stimulants. They make your heart beat faster and sometimes irregularly. If you already have a sensitive or compromised heart, this extra stimulation can destabilize your entire cardiovascular system. Recently, European health agencies have refocused attention on pseudoephedrine due to its connection with rare but serious syndromes involving blood vessel constriction in the brain. This only demonstrates how powerful its effects are throughout the entire body. The major danger with these medications is that they're available over the counter. People purchase them without reading the fine print and without considering the potential risks. If you're over 60, and especially if you suffer from hypertension or any heart condition, avoid them completely. There are much safer alternatives available: saline nasal sprays, humidifiers, or nasal corticosteroid sprays that act only locally without affecting your entire cardiovascular system. Now we come to our fourth category, a delicate but vital topic related to mental health. I'm discussing a class of older antidepressants that are still used today, sometimes for depression and other times for chronic pain management. These are called tricyclic antidepressants, with names like amitriptyline and imipramine. Depression itself is actually a risk factor for heart disease, which is why treating it is crucial for overall health. However, how we treat it matters significantly, and these particular medications can be dangerous for an older person's heart. Let me tell you about Robert, a 79-year-old patient who suffered terrible foot pain from his diabetes. His doctor prescribed a low dose of amitriptyline for pain management. It helped significantly with his discomfort, but he began experiencing dizziness every time he stood up. One day he fainted and fractured his hip in the fall. The cause was the amitriptyline triggering severe orthostatic hypotension, a dangerous drop in blood pressure when changing positions. But that's not the only cardiovascular risk these medications pose. Tricyclics can also accelerate your resting heart rate, creating constant stress on an aging heart. More concerning still, they can interfere with your heart's electrical conduction system, slowing down the electrical impulses that coordinate heartbeats. This shows up on electrocardiograms and increases the risk of dangerous ventricular arrhythmias that can cause sudden cardiac death. For all these reasons, tricyclic antidepressants are no longer the first choice for treating depression in older adults. Today, we prefer newer antidepressants that are much safer for cardiovascular health. However, they're still sometimes prescribed for neuropathic pain management. If you or a loved one is taking one of these medications, it's essential to discuss this with your doctor. Have safer alternatives been tried? Are blood pressure and heart rhythm being monitored regularly? Mental and physical health go hand in hand, and we must ensure that treatment for one isn't damaging the other. Finally, we reach our most controversial and debated point, but it's my duty as a physician to share the concerns that exist within the scientific community. I'm talking about calcium supplements. Yes, you heard correctly. Those pills that millions of people take daily to protect their bones from osteoporosis. For decades, the message was crystal clear: take calcium for strong bones. But in recent years, an increasing number of studies are questioning the safety of these supplements for cardiovascular health. Let me share the case of Dorothy, a 71-year-old woman who, concerned about osteoporosis, began taking high-dose calcium supplements on her own. Years later, she suffered a heart attack. She didn't have the classic risk factors we typically see. She didn't smoke, her cholesterol and blood pressure were well controlled, and she had no family history of heart disease. When investigating possible causes, her medical team focused on that daily supplement she'd been taking for years. The controversy is real, and the evidence isn't definitive, but the hypothesis deeply concerns the medical community. Calcium obtained from food sources like dairy products or leafy green vegetables doesn't appear to be problematic. It's absorbed slowly, and the body utilizes it efficiently. The problem seems to arise with high concentrated doses from supplements. When you take a calcium pill, it creates an artificial spike of calcium in your bloodstream. Your body can't use all that calcium for bone building, and the excess has to go somewhere. The primary concern is that excess calcium deposits in artery walls. This process, called arterial calcification, makes arteries rigid and can contribute to the formation of plaques that cause heart attacks. Some large-scale studies suggest that calcium supplements modestly increase heart attack risk, while other studies haven't found this connection. The evidence remains complex, and for people with diagnosed osteoporosis, the benefits might outweigh the risks. But the lesson is clear: more isn't necessarily better. The safest strategy is obtaining calcium from your diet through natural food sources. If your doctor believes you need a supplement, never start taking one on your own initiative. This is a medical decision that must weigh your bone health against, very importantly, your cardiovascular risk profile. Your doctor can help determine if you truly need supplementation and what the safest approach would be for your individual situation. Today, we've uncovered the hidden side of 5 categories of very common medications: anti-inflammatory drugs, stomach acid reducers, decongestants, certain antidepressants, and calcium supplements. My main message isn't one of panic, and I'm definitely not suggesting you stop taking your prescribed medications. Doing that on your own would be extremely dangerous and potentially life-threatening. My message is one of empowerment through knowledge. You now have valuable information that many people remain unaware of. You know that your arthritis medication might be overloading your heart. You understand that your stomach protector could potentially be affecting your heart rhythm. You're aware that a simple cold remedy might pose cardiovascular risks. You can use this knowledge to become an active partner in your own healthcare journey. The next time you see your healthcare provider, go prepared. Bring a comprehensive list of everything you're taking, including over-the-counter supplements and vitamins, and ask clear, direct questions. Doctor, I've read that this medication might have risks for my heart. Is it still the best option for my specific situation? Are there safer alternatives we could try? Should we be monitoring anything specific, like my blood pressure or certain lab values? Every medical treatment represents a balance between benefits and risks, and that balance changes as we age. Your heart has worked tirelessly for decades. It deserves exquisite care and attention. Protecting it is the best investment you can make in your future quality of life. Never take any medication for granted, no matter how common or seemingly harmless it appears. Remember that open communication with your healthcare provider is your strongest tool for maintaining heart health while managing other medical conditions. Don't hesitate to ask questions, request second opinions, or seek clarification about any concerns you might have. Your active participation in your healthcare decisions can literally be life-saving. If this information has been helpful to you, I'd love to hear about it in the comments below. Share your experiences or questions about medications you're taking. Your stories could help others facing similar situations. Please hit that like button if this video provided valuable insights, and don't forget to subscribe to our channel for more evidence-based health information designed specifically for people over 50. Most importantly, share this video with friends and family members who might benefit from this knowledge. A simple share could start a conversation that truly saves a life. Take care of yourselves, and remember, your heart health is worth every effort to protect it.